Hello, anatomy colleagues. This is Dr. Alsip, and I hope you're having a great day. And if you weren't before, I'm sure you will be after you view this video on the wonderful world of the cranial osteology you need to know regarding the mastication session. We will have a separate video on mandibular osteology, so we'll not be discussing the full skull in this video, but there's a lot of good stuff, so let's get started. All right, we're going to start with a review structure. But that's pertinent to this session because it is the foramen that allows the mandibular nerve, or V3, to exit the skull. So I want you to take this moment and try to find the foramen ovale located on the greater wing of the sphenoid on your own. So take a moment. Hopefully you're pointing at it right now, and you are locating this as the foramen ovale. So this nice, fairly large oval shaped foramen located on the greater wing of the sphenoid. All right, it's going to also be the path by which the lesser petrosal nerve exits the skull. All right, so there is a lot going on in this slide, and we are going to take our time to work through these structures. We are looking at an inferior view of the crania, which this photo has been cut off in this region. It's cutting off some of the more posterior portions, so we can focus more on this portion of the image. And this complex right here, so I'm going to kind of outline this entire region, is going to be the pterygoid process. All right, so this whole region right here will be the pterygoid process. And it's going to include two plates of bone. The more lateral one, which I'm only going to label just a small portion, is going to be the lateral plate. And the more medial one will be the medial plate. Notice that the medial plate has a projection right here that I'm outlining that is going to be referred to as the pterygoid hamulus. And a tendon of one of the soft palate muscles, the tensor veli palatini, is going to glide along this hamulus to kind of change the direction where the tendon will attach. Functionally, this lateral plate is related to the infratemporal fossa. In fact, it's going to form the medial wall of the infratemporal fossa, and it's important in terms of attachments of the medial and lateral pterygoid muscles. In fact, the relationship of the pterygoid muscles to the lateral plate is where they get their names, medial and lateral. The medial pterygoid plate is more related with the pharyngeal region, being an attachment point for the pterygomandibular raphe and one of the attachment points of the superior pharyngeal constrictor. Okay. We'll come back to this region in just a moment, but let's take a break to find the sphenoid spine, and I'm going to outline the sphenoid spine right in this region. And this one's a little bit more difficult to see. It's on a much smaller scale than, say, some of those pterygoid plates. It's going to be near the foramen spinosum, as well as the external opening of the carotid canal. So those are two structures that I like to find because they're easier to locate in order to find the spine here. So it's a spine or a projection, so this likely means something attaches here, which is the case, and it's going to be the sphenomandibular ligament. Okay, returning back to the pterygoid process region, we're going to look over at this one that I haven't outlined already. There are going to be two fossae located in between the two plates. So this one would be the medial plate on this side and the lateral plate. And so we're going to be looking at this region in between the two plates right here. The pterygoid fossa is going to be the more inferior of the two. So I'm going to label this region right here. Remember that we're looking at an inferior view here. And the scaphoid fossa is going to be the more superior or more closely related to the base of the cranium. Sorry if you heard my email pop up in the background. So, recall that the medial pterygoid muscle is going to be located in this general region. And the scaphoid fossa will be the origin site for the tensor veli palatini, which is a soft palate muscle. Lastly, lastly, for this slide, let's locate the pterygoid canal, which is an opening. I'm going to outline a little bit where it would be located. So it's an opening of the sphenoid bone, but it's closely related to the basilar part of the occipital bone right here. So I always try to find that, and then it's going to be this opening right where you're entering into the sphenoid region. This is where the nerve of the pterygoid canal, which is heading for the pterygopalatine ganglion, is going to traverse this region. So that pterygopalatine ganglion is one of the peripheral parasympathetic ganglia. All right, let's move to a lateral view of the cranium, and we will start with trying to locate the infratemporal crest, which is going to be located right here, what I'm outlining. So we have it here as part of the sphenoid bone, but it will also extend towards the temporal bone as well. And it is going to be an attachment site for the temporalis muscle, which makes sense if you think about the main area where the temporalis muscle is going to be located. It makes sense that it would have an attachment right about here-ish as well. All right, we are likely, hopefully, familiar with the styloid process at this point. If not, make sure to review this. This will be an attachment site for various ligaments associated with the TMJ, and then, of course, some other muscles that we've already discussed and some that we've yet to discuss. And lastly, on this particular side, let's locate the maxillary tuberosity, which is going to be located right here where I'm outlining. I always go to the very back of the maxillary teeth, and the rest, kind of the posterior extent of the maxillary bone, and it's going to be located right there. It's a little bump in that region, so that's going to be the maxillary tuberosity. The medial pterygoid muscle will have an attachment here, so that's kind of that maxillary attachment point that we've talked about for the medial pterygoid. All right, let's focus on the zygomatic arch now. The zygomatic arch is going to extend from here-ish to about here-ish. Sometimes you see it referred to as here, sometimes it'll extend all the way back to this region. We don't need to get into that level of detail. We just need to understand the basics of where the zygomatic arch would be located. And it's going to be composed of the temporal process of the zygomatic bone, as well as the zygomatic process of the temporal bone. And they join together, and you know that because you can see a suture right here. And when you add those two processes together, you have the zygomatic arch. You can see that the zygomatic process of the temporal bone is going to be longer than the temporal process of the zygomatic bone. Now note right here that there is an inferior projection of the zygomatic process, or the zygomatic arch, which is the articular tubercle. I love the articular tubercle, and I love to talk about it. This is going to form the anterior limit of the mandibular fossa, which means it's an anterior limit of the TMJ. And if we're talking about a TMJ dislocation, what will often happen is this mandibular condyle right here will extend anterior to the articular tubercle, so it'll kind of go over that bump right there. But there should be ligaments and a capsule all in this region to prevent that from happening. All right, so recall that the mandibular fossa is this depression right in this region here for that mandibular condyle to sit. So this is the cranial portion of the temporomandibular joint. It is a smooth area because articular cartilage sits in this region during life. Now, just posterior to that region is the petrotympanic fissure. So just posterior to the mandibular fossa, you can see it is very thin, but it's easier to locate if you know where that mandibular fossa is. So always find mandibular fossa and look just posterior for a thin fissure. The chorda tympani will exit the skull here. And again, here is another view of the styloid process. It looks very different when you don't see it projecting in the typical relationship that we are used to. So it's always nice to look at these processes or any of these structures in as many views as possible. Lastly, let's identify the superior or proximal attachments of the temporal muscle and fascia. You're going to have two lines here. The superior temporal line, which is located right here, put an ST, is going to be an attachment for temporal fascia, whereas the inferior temporal line, which I'll put an IT right here, is going to be an attachment site for the temporalis muscle and its tendons itself. Sometimes the lines are not very obvious, but they certainly are on this particular donor here. So just be aware that there are typically two lines and that the fascia is going to be associated with the superior temporal line, whereas the tendons of the temporalis muscle will be associated with the inferior. All right, so that was a lot of good cranial osteology fun. As you review this material, and if you have any questions, please feel free to reach out to me or any of my anatomy colleagues. Thanks for your time and attention, and have a great day.